The webinar will start in a few minutes. Please stay in the line. Thank you. Hello, everyone. Good morning or good afternoon, depending on where you are listening to us. I would like to start by thanking everyone for joining us in our webinar. The webinar will focus on sharing our COVID-19 experience, seeking feedback, and is sponsored by Hovione. My name is Isabel Pina. I'm the Director of External Communications at Hovione, and I will be the moderator and host of our today's webinar. So, before starting, I would like to mention some housekeeping information. Our webinar will take around 40 minutes plus 20 minutes for Q&A. If you have any technical difficulties regarding sound or any other issue, let us know by using the chat feature. Also, please feel free to submit your questions at any time using the Q&A feature, and we will attend to them during the Q&A session. So, for those who are not familiar with Hovione, let me tell you that Hovione has more than 60 years of experience as a specialized integrated CDMO. We are around 1,900 people in 5 sites across the globe, and we operate as a fully integrated pharmaceutical developer and manufacturer from APIs, formulations to final unit doses, with all activities performed at the same site. So now let me introduce our today's speakers. So the first speaker, Mónica Barreto, joined Hovione in 2011, starting with quality control, where she spent several years managing laboratory teams to maintain high standards of quality and compliance with pharmacopoeia guidelines and GMP practices. Currently, Mónica is responsible for coordinating the preparation committee, as known as PrepCom, a multifunctional COVID-19 response team created to prepare the company to deal with the crisis. Mónica holds a degree in molecular and cellular biology from Nova University in Portugal, a post-graduation in integrated management system for quality, environment and safety, and an executive education in advanced program in project management and evaluation. So, our second speaker of today is Álvaro Lopes. Álvaro joined Hovione in 1999 as a production engineer. Álvaro was appointed Health, Safety and Environment Director in 2015, reinforcing the company commitment to manage its activities in accordance with the industry best practices and principles of protecting the health, safety, and the environment. Before that, Álvaro had assumed different roles in logistics and in manufacturing as head of production of steroids and explosives. Álvaro is graduated in chemical engineering by Instituto Superior Técnico in Portugal. So, with no further ado, I will now pass the presentation and microphone to Mónica. Please enjoy the presentation.
Thank you, Isabel. Good afternoon. As the name of this webinar suggests, this is a webinar that aims to share how we have organized ourselves to deal with the COVID-19 pandemic, sharing experiences, successes, failures, and taking the opportunity to learn from others. We will focus our presentation in 4 main topics. Sadly, it won't be possible to go in much detail on all initiatives that we have deployed, as we don't have the time. But we will focus on the things we think can make a difference. First, how our COVID-19 response team operates. Second, how do we communicate with our team members, clients, and stakeholders? Third, the most relevant initiatives and lessons learned. And fourth, how we are planning to return to this new normality. After the webinar, in case you would like to know more, you can always access our website where we made available several documents and videos, or you can also reach us offline. Having a manufacturing site in Macau meant that Hovione had an early exposure to COVID-19. That allowed us to start immediately preparing ourselves for the key organizational challenges expected. We are an organization centered on people, so from the beginning our focus has been our team members. Our individual reality has made us keep the production sites working, not allowing us to send all staff home. Therefore, it has been our priority to implement a series of preventive measures that can keep safe those coming to the facilities and those coming or working from home. The Preparedness Committee, also known as PrepCom, is a cross-functional COVID-19 response team created to prepare the company to deal with this crisis, having as a main goal the team members' safety and business continuity. The PrepCom has direct responsibility in Portugal facilities, paying the adoption of specific measures delegated to the individual manufacturing facilities. This way, we make sure that the respective country's government and health authorities' directives are always followed. To focus the team in all working fronts, the several activities were split in 4 different work streams. First, health and safety, to develop and implement the necessary measures to protect our team members and their families. Second, supply chain, to guarantee a strong and stable supply chain to make sure operations continued running. Third, sales and customers, to maintain a close monitoring of our customers, assessing their needs and possible risks, allowing us to act preventively as we could. And fourth, communications, to implement a robust internal and external communication channel, promoting transparency, confidence, either with our team members, clients, and stakeholders. Now, as we progress in COVID-19 pandemic, it has been recently decided to adjust the focus of this team, which now aims to prepare the company for this new reality. So PrepCom evolved to version 2.0, leaving outside the supply chain and the sales and customers work streams. These are now expected to be part of the normal routine of the respective areas. On the other hand, we incorporated the social responsibility activities, such as the pro bono disinfectant gel, and the continuous investment on the business continuity plan. The PrepCom is organized in a cross-functional team, covering areas such as HAC, HR, legal, purchasing, sales, marketing, communications, production, logistics, IT, and others. Each work stream has a leader and a team responsible. The overall PrepCom is managed by a project coordinator, myself, and a project sponsor who bridges with the executive committee. The core team meets regularly, starting from a daily frequency to a 3 days a week frequency. In these meetings, the relevant topics are discussed and decisions are taken. Whenever a significant decision which go beyond the team authority is required, this is escalated to our executive committee, which we meet once a week to share the latest news, status, and decisions needed. We also have a routine to bring the sites together to understand the situation on their facilities, sharing procedures, successes, failures, out-of-the-box ideas, and any need for help. During this process, we have been learning how important communication is during these situations. People that don't know what is happening don't understand and consequently don't commit. So we have been very active in the internal communication. We use email for official internal communication, WhatsApp to share best practices and good news, videos with public content and done by our team members, TV screens in the plant, posters, spreads in the premises, and a lot more. We have a group email where people can send their feedback, questions, and even ideas they heard about and that they think would be good to implement. And we communicate on a daily basis. Here are just a few examples of internal communications using internal email and WhatsApp group. Sharing best practices for those working from home and asking for their feedback to know where we need to act. Here are also some posters that we have prepared and that we usually display in our TV screens and walls all over the premises. As for our customers, we understand it is part of their business continuity plan to assess the risks near their suppliers. So in order to respond to their questions about how things are going and which are the impacts we are seeing, we decided to share monthly communiques with the status from each of our sites. These communiques are available in our website for everyone, being also shared directly with our customers by Hovione sales representative. This way, we make sure the information is transparent and available, shared in one voice, and avoids miscommunication and misunderstandings. Now, to give you further insight in some of the initiatives that we have deployed, I will hand over the presentation to my colleague, Álvaro. Thank you.
So thank you, Monica. So good morning or good afternoon to all. It's Álvaro speaking, and I will now lead the presentation regarding the main initiatives implemented and respective lessons learned, as well as the topic related to the return from home stage that we also called the new normal. As we imagine, one of the main tasks performed in the early stages of this pandemic was the creation of the contingency plan. The contingency plan was created considering different evolving scenarios in alignment with the spread of the pandemic in Portugal, being the final scenario the existence of confirmed cases inside the site premises, incorporating a risk management approach with priorities clearly established. The business continuity was integrated in the site contingency plan. We had the need to detail the site business continuity plan for this specific scenario of the Covid-19 pandemic. And this was done in 4 stages. First, we made a detailed risk assessment through several exercises and considering multiple dimensions. This was where we have identified the major risks that could directly or indirectly impact our operations, and have defined the actions to mitigate those risks. Here, we have considered the probability of getting to a situation of lack of PPE, like masks, respirators, protection suits, the lack of raw materials, the lack of utilities, for instance, the nitrogen that we use for the equipment and inartization, that is safety critical, is supplied by trucks in the liquid form. So what happens if we have an outbreak in this supplier? We have to take in consideration that this may have stopped the operations in a couple of days. So what alternatives do we have? Also to consider the lack of transports, as some international borders may be closed, and the air transport if it continues to operate. Another point is the lack of human resources, lack of production operators, QC analysts, or maintenance. And finally, which are the critical service providers. So with this information, we have to set priorities. So this is the second stage of the business continuity plan. We have defined what to do in case something fails, based on a risk level for Hovione, for product commercial value, the impact on early sales revenues, but also on the client's perspective, if we are a single supplier or not, and finally in the patients in the market. So is it a life-saving drug? Can we have a market shortage or not? So the third step was to include the decisions and mitigating measures in the contingency plan, and to provide more detail in case we need to partial or fully stop the site operations, so how to do it safely. And finally, we defined the restart stage. If we then need to restart the operations, how should we do it, where to start, who is involved, and how long it takes. As we imagine, this took us some time to accomplish. And we know that this is a continuous process. We continue to gather this team in a routine way to evaluate the pandemic evolution and its impact in all dimensions. So one of the main relevant initiatives implemented was the health survey. This was implemented in mid-March with the aim to act fast and preventively. So it consists in what? First, in a health check questionnaire, just a simple informatic tool to allow the Hovione team members to report bi-weekly on Mondays and Thursdays, information reading regarding the recent travels or contacts with people that have traveled, the contacts with suspected or confirmed cases, or if we present any COVID-related symptom. We have an internal team with members from AJC, Human Resources, and the occupational doctor that meets daily, weekends included. We review the data and take decisions on the proactively manner, sending people to quarantine isolation or to be tested. The second thing is the site screening or the on-site entry checkup. So we perform mandatory temperature measurements to everyone entering the site. And in order not to conflict with the GDPR, the data protection regulation, we do not record the temperature measurements. We just perform the temperature readings. If the temperature is lower than 37.5 degrees, the site access is granted. So external contractors and visitors are required to fill in the same questionnaire at the premises. So by checking the graphic data, we can see higher values reported at the beginning. So this was the learning stage, as we had to train and make people aware of what is a casual or a close contact or a suspected case. And also, due to psychological factors, we also had many people reporting COVID-related symptoms at the beginning. So this was tackled and clarified by the occupational doctor. Then things normalized, and now this is proven to be a powerful initiative for the team members who have a trustable and fast communication channel with the organization. The next relevant initiative is the decision protocol upon a suspected or confirmed situation. And this is divided in three elements. First is the medical assessment. So the occupational doctor is available for the assessment and follow-up. This is essential. Then it's the isolation room that is available in case you have any suspected situation in the site. And final, the test prescription by the occupational doctor. The second point is the contact tracing. So you have set a protocol on what to do in each situation for confirmed or suspected cases, for close or casual contacts. This is very critical. We have made it very clear for the team members which is the protocol in each case. And then the third is the protocol with the testing labs. So we have set a protocol with local labs to allow easy access for our team members, including the expenses coverage by the insurance company. Also related to this initiative is the mapping contacts. So the team members must record daily all their site contacts, identifying if they are close or casual contacts. This makes all contact tracing process much easier in case we need it. This way, we have all the information related to past contacts of our team members, allowing for a fast decision on who should be placed or not in quarantine. The close contacts, besides the quarantine, are also tested after 14 days. The casual contacts may also be tested depending on the test availability and the priorities that we have set. The final stage is the isolation and quarantine. So we send safety kits to people in quarantine, making sure that they have enough masks, gloves, disinfectant gel for them as well for their relatives. And we set a regular communication with all those cases in order to check if they need some other assistance. Other relevant initiative implemented was related to facilitate those who were working on site with these two welfare services. The aim here was to reduce the risk of infection, as during the access to supermarkets, we need to touch in multiple objects and surfaces, and the online supermarket delivery services were overloaded. So in our Lourdes site in Portugal, we made available a daily takeaway service for individual family meals at a symbolic price, and the online shopping service for first necessity goods that are delivered bi-weekly at our site. We have also remembered those working from home. So two initiatives were implemented that are deserved to be highlighted. The first one was the well-being and safe work environment. So we have provided online psychological and financial advice, and we have allowed for our team members to take home their office equipment. There's the computer, the screen, the keyboard, the mouse, even their chair if they need it. The second was related to productivity. So we have made a survey to understand the main challenges and difficulties of these team members working at home, in order to share some experiences with the Hovione community. We have issued working from home tips by email or through videos that were performed by our own team members. And finally, we have made some online courses available, for example, related to issues like remote team management. In-house production and pro bono distribution of disinfectant gel. So this was a social care initiative that started in our Macau sites and was then implemented in all Hovione sites. We not only produce disinfectant gel for our internal needs, but also have distributed pro bono to many national entities across Portugal. We provided gel to municipalities, fire departments, hospitals, health organizations, police departments, etc. Until today, we have produced in our Portuguese site 284 tons of the disinfectant gel and distributed to around 600 different entities. So we respond to a social need when the market was not able to provide its essential product to fight the pandemic. So one of the main lessons learned was how to manage the contractors. So we have put our main focus initially in the Hovione team members, but the outcome of the pandemic evolution in Portugal have shown us that the outbreak was mainly focused on the service provider companies. So the way to respond was to list all the contractors and perform a risk assessment analysis based on the frequency of access to the site. So if they are at the site daily, every 2 weeks, or monthly, to check the contacts between them and our team members. So if they have limited contact with just one department or multiple contacts with several departments, and also if they work exclusively at our site or not. So based on this assessment, we have established different levels of risk and set specific access conditions. For instance, for the higher risk, we require a PCR test to be performed every month. Then we put also our focus on training and awareness, making sure that they all receive training and are aware of the main rules of the contingency plan. So specific communication channels were set by a WhatsApp group, for instance, and we have improved their working conditions, mainly in the canteen, ensuring they can have a meal, respecting the safe distance, and by installing vertical physical protection on the tables. Finally, we have distributed masks and hand sanitizer for them to take home. We also made a reference guide with the main rules to be followed in the site. So this guide is distributed at the entrance to every contractor or visitor. It helps everybody to have a clear understanding of the main rules to follow. Just explain, for instance, what is a close or a casual contact, where is the site isolation room and purpose, the point of contacts in the site, etc. So the fourth main topic of our webinar is related to the stage we call the new normal. So we have defined a strategy to allow the safe return of our team members that are working from home. So this needed to address the question, how to do it in order to mitigate the risks. So the return from home strategy was set as a gradual process and divided in 3 stages. In stage 1, we allowed the return of 1/3 of the people working from home. On the next stage, if the pandemic situation is under control and if we don't have new cases in Hovione population or our contractors, we allow for the return of half of the people working from home. And finally, the 3rd stage considers the return of all team members to the site, including the high-risk cases, which are the pregnant or groups under special protection defined by the local health authorities. The criteria for this final stage is to have a vaccine or an antiviral widely available at the market with proven efficacy. So how do we have implemented this? So we have made 2 options available for the area's organization. One option was to divide the areas in 3, or the other option is to divide the areas in 2 teams, so depending on the size of the area team members. For instance, if we have a shorter team, we should divide it in 2, which is a team A or a team B, which is the bottom option. And the strategy is to provide the team's rotation. For every week on site, they need to stay 2 weeks at home, which represents the SARS-CoV-2 quarantine period. The teams should also split, taking into consideration their redundancy, making sure they are well balanced regarding their autonomy, their skills, and their authority. The team members' access to the site was previously authorized by AGC and Human Resources. So the priority was given to critical areas like production, the QC or maintenance. And the final criteria was to make sure that all the people could sit 2 meters apart, respecting the safe distance. So this stage 1 have started in early June, and we have some very good results till now. So also to prepare the return from home, this 1st stage, we have prepared a practical guide to support our team members on their return and made it available through multiple channels. In paper-based, in videos, we provide online training, for instance. Here you can see the index of this practical guide, where the team members can have access to who is the preparedness committee, so our crisis committee, who are we, our points of contact, what it is expected from every one of us that are returning to site. It explains all the safety rules implemented and provide also some guidance, for instance, on the travel policy. Here you can have, for instance, 2 detailed figures of the guide content. In this case, for guidances regarding the business travel, in which is stated that the business travels are only allowed if they are critical for the business. It is described that they need to be approved by the area director and the AGC, and that the travels between sites needs to have the site and manager approval. For the site visitors, the external visitors, it's also set some guidance in which you need to evaluate the situation of the pandemic evolutions on the countries of origin. We provide some instructions that we need to follow the local health authorities, and also some guidance that in some cases a test may be required for an external access to the site. So this was these 13 rules that you see here was the process that we have made. We have created 13 safety rules for this return from home stage. And the 13 rules, they represent all the measures that were set in place for simple, more usual rules like the safe distance, to wash or sanitize your hands and to use a mask, but also some guidance regarding the meeting rules, the safe travel policy, so to provide some guidance that we should travel alone, if not, to use a mask when more people are inside the car, and also some other guidance. So all these rules are made available through the site, also through multiple channels, or through videos, to posters. We have made a mandatory process for training for all the people that were included in the return from home. So the next slide is regarding the final initiative that we are about to implement in a week's time. So one thing is that when we have people that are suspected, we need to follow the health authorities' directives and test our team members. So what happens to the rest of the population, that is the majority, that are symptomatic and that we don't know if they are maybe infected or not? And as we understand, we cannot test them every day. So we are putting in place a process for a random testing for the asymptomatic persons that include the team members and the contractors. So we have signed a contract with a local provider in which a professional nurse will come twice to the site to provide the sampling for the test by PCR. And here the objective is to test, to find, isolate, and to treat. So the final initiative, this was something that was implemented, is led by the Hovione Interims, and it is a contest that Hovione is promoting, aiming for the younger students in the age of 10 to 20 on the higher basic school. And the challenge here is for them to create a small video, a 1 minute video, for them to explain or teach us how they live in the COVID-19 pandemic. So this is now on the third week rolling. So we already have two winners, and we invite you to check their videos that are very creative. And this was the process how we have engaged the younger generations. So I'm finishing my presentation, and I'll pass again to my colleague, Monica. So thanks for listening to me.
Thank you, Walter. So before finalizing this presentation, I would like to add a few final thoughts. This has been a long and new journey. Like so many others, we still struggle with many concerns, the need for decision, good and bad times. But until now, we believe many of the actions implemented at Hovione were essential to keep our people safe and the operations running. And for sure, this has only been possible due to our team members' commitment and big effort. Still, it's not over yet. Most likely, it will take years to return to the normalcy that we once knew. And we know that there are still challenges ahead. Some challenges we will overcome easily, but others it won't be that easy. What we do can seem small in a worldwide perspective, but we really believe that if all of us contribute with a small part, at the end it will be big. So thank you. I will now hand over the presentation back to Isabel.
Okay, so thank you so much, Monica and Álvaro, for such an interesting presentation and for sharing our COVID-19 experience with all our attendees. So this webinar is also about seeking feedback. So we now open the panel for those who wish to share their experience. For those, please send a message in the chat and we will open your microphone individually for each one of you. So if you want to send questions, please use the Q&A feature. We have 20 minutes for Q&A. Okay, we are here, our speakers are here and they are available, and we would also like to hear from you your experience and your feedback. Okay, we have a first question that just arrived. And the first question says, having a small business and a limited team to address these challenges, what would be the top 3 measures you would like to recommend? Maybe Álvaro, would you like to reply to this question?
Okay, this is in fact a good question, so thank you for placing it. So just let me think for a while. So the top 3 measures. For sure, the first one would be the communication, because that's the base for everything, either internally or and external. The second point probably is that the precise safety measures that you need to put in place for all the team members, and this is the entry screening, the health follow-up. Make sure you have masks and disinfectant gel available for everyone, not just that working on the inside, but also to make it available for them to take home. And the third is the contractors that visit your site on a daily basis, and would say that they should be very well briefed with the safety measures you have in place, so everybody can play by the same rules, with our team members and the contractors, I'd say.
Okay, thank you, Álvaro. So next question. Can you hear me now? Okay. Next question. In your communication, there was a note about absenteeism reduction. Will Hovione adapt its work methods in the future, allowing its team members to work from home in a regular basis? Monica, maybe you would like to give your reply to this question.
Okay, what I can tell you at this point is actually that Hovione has a work from home policy. It is now being revised by HR, and we'll have in consideration what we have learned during this pandemic situation and having several people working from home. But we will have more news on that in the upcoming weeks.
I have someone here maybe that would like to make some comments. Amélia Delgado. You mentioned that communication is a key aspect. Would you like to share some views with us? Amélia? No, maybe not. Okay, let's move on. So next question. When do you expect to have all team members back in the facilities? Is it the same in different geographic locations? Álvaro, maybe you have the answer for this one.
Okay, so if it's the same in all different geographic locations. No, I think it's not the same in all sites. As we all understand that the situation today in Portugal is completely different from in Macau, where they probably are now in more than 45 days without a single case being reported. So we just to follow the health authorities guidelines also for each country, and I think then we need to adjust constantly our strategy accordingly. So at this point, for example, in Portugal, we already started the phase 1 in the beginning of June, which means that we are taking back a third of our people that were working from home. But another example is our US site, where we still do not have a precise date to return. So this needs to adapt to the local evolution of the pandemic. It is not the same in every geography.
Okay, thank you, Álvaro. So moving on next. Okay, do you see contractors being a big part of your plans for the foreseeable future? Either of you? Yes?
Well, it's Álvaro answering. Yes, I see, because in fact today, with the numbers of the pandemic evolution in Portugal, they now represent our main focus. So we are adapting our strategy of the contingency plan also to cover that. And for sure that we already have made some other measures, have implemented other measures that were not included in the webinar, but for sure they will be a critical part in our success to fight and win this war against the COVID-19. Yeah.
Thank you, Álvaro. So next question. Can you discuss how you modified laboratory operations, both in the layout of the labs, bench spaces, for example, and prioritization of projects and personal traffic in the lab spaces? Maybe Monica would like to reply to this question.
Okay, so we did have a big challenge with the laboratories. At the beginning of this pandemic, we understood that, in fact, it would be difficult to maintain the 2 meters distance between the analysts. So what we did at that point was to look into the lab and to understand what we could change. And what we did was to split the teams. So people that was working together, they were split in different teams and different shifts. So ones worked in the morning and the others were working in the afternoon and during the night. This way, the labs were less crowded. Additionally, we also took some equipment to different areas of the factory, new labs that we were installing at that point, and we speed up the qualification of those equipments in order to move analysts from one building to the other. Another thing we did was to look into their circulation. How did they move within the lab? And we established different circulation pathways within the lab. For instance, and to give you actually a curious example of our R&D labs, they actually divided the team and they gave them color. So they color-coded the teams in order to make sure that people with different colors, they did not contact with other teams that were not from the same color. This way, they could reduce the number of contacts between different people, making sure that the risk of infection, of cross-infection, was reduced.
Thank you, Monica. Moving on. I think Amelia Delgado has lots of questions, and she says the phone is muted. No worries, Amelia. We will reply to the questions. So, next question. I noticed in SME that communicating with contractors is challenging because they either panic or disregard rules. How did you manage to let them know they had to follow strict rules without damaging the relationship? Álvaro.
So thank you, Amelia, for this question. And in fact, the communication with contractors, it's difficult because we have different levels of contractors. Those that we engage typically every day. We have a long relationship, and others not well in a different situation. But the communication channel was set by our purchasing department directly with their top management. And we have sent them a memo notification for them to make sure that they will align by the rules, that they also provide training on their own contingency plans for their workers, because we can provide some training, and we are providing some specific training on all contractors that access the sites. But in fact, they are not just work on the sites. They are not our team members, and we have limited responsibility for them. So one way to control if they are following the rules or not is that we have implemented some internal audits to the contractors that is specific for the COVID, to make sure if they are or not following the rules, if they are aware of the rules, and if they're not, we just put a report and send for their top management with also with a notice. If they don't follow the rules, their access to the site may not be granted in the future.
Thank you, Álvaro. So next question. I think you had an advantage being in Macau and seeing it firsthand and early. How has Macau fared, and what lessons did you learn, and what changes did you make? Monica?
So Macau was indeed, I can hear myself. Macau was indeed the site that was first challenged by the COVID-19 pandemic within Hovione. And in fact, they had a very fast response to that. They actually implemented a set of measures that we took internally for the other sites once this pandemic started to spread to worldwide. And it was like measures related with control access to the site for staff, visitors, contractors, health survey, body temperature, use of masks. Actually, their geographical location helped us to get masks in Portugal and the other sites when we noticed a shortage in the beginning of this pandemic. But they also implemented other measures such as workplace hygiene best practices and the availability to their team members to disinfectant gel and masks for them to take home. They also made us aware that it was fairly important. It was very important to have the team well prepared and well aware of what was this infection and how they could protect themselves and the site as well. So those were very specific measures that they put in place very fast, and that we had the chance to understand that they were very useful and bring to the other sites as soon as we started to see this pandemic spreading.
Thank you, Monica. So next question. Do you feel comfortable with these initiatives? What do you believe will be the next biggest step? Monica, maybe you would like to reply.
Well, the initiatives we have in place are basically to ensure that people feel and are safe while working on sites, and to guarantee that our business continues. Regarding the next big step, I would probably mention the implementation of the routine testing plan for our team members. We understand and we believe that it will allow us to act preventively on any or avoiding any outbreaks.
So thank you, Monica. For this moment, we do not have any other questions. I don't know if there is anyone that would like to send any questions for the next seconds. So, if not, I think there is another one coming. Okay, during the pause time for eating, which were the main activities took in place? During the pause time for eating, which were the main activities took place? Maybe Álvaro?
Well, I understand the pause time for eating, not exactly the eating period, but what is right after. So probably the coffee time. So we have removed in our cafeteria the majority of the tables, and we have provided a disposition of the tables in the cafeteria to allow to make sure we have the safe distance between the people that are taking their coffee. We have limited, for instance, the presence of the maximum of 2 team members per table, and we have provided clear instructions for people to be there for the lowest time as possible, as this is one of the situations of higher risk, because we are taking the coffee without our masks. So if we implement all these safety rules and then we are talking with one of our colleagues without a mask for a longer period, this is not probably the safest thing to do. So this was the major implementations that we have done after the pause during the eating period when people take their meals. So in the canteen, we have implemented the vertical barriers in the tables, because it's not possible when you have a site with almost 1,000 employees there. But nowadays we have about 400 meals taken every day, so it's not possible to ensure during that period that people take their meal at a distance of 2 meters apart. So we have implemented the physical barriers to assure more distance, and we also made it available some disinfectant for people to disinfect the location where they are taking the meal before and after. So these were the 2 major implementations that we have done in the canteen.
Okay, so I think we have reached the end of our webinar. I would like to first thank Monica and Álvaro again, and I would like to thank everyone for your time and for attending this webinar today. We would also like to remind all of you that we have made available our protocols, procedures, training, materials, and communications available in our website www.hovione.com on COVID webpage. Please feel free to share them with your families, friends, and colleagues. The information is there and are to be shared. Also, we believe that this is a common fight and that we will be stronger if we work together and learn from each other. We hope you have found this event interesting and useful, and we look forward to welcoming you again in one of our next webinars. So please keep an eye on our website or follow us in LinkedIn. Thank you once again, and we hope you have a nice rest of the day. Thank you. Bye.